Hey everyone, welcome to Tea Time Tuesday. I'm going to start out with just going through a bunch of questions that have come in since we last did a Tea Time Tuesday. And thanks so much for joining me. The first question that came in is SGB, left versus right side, dressing bloating. Is this one right, Sarah? I had a SGB a week ago because of why isn't everyone doing this episode? First of all, thank you. Secondly, can you talk about doing a block on the right versus left side of the neck? I went through Stella and the PMHNP mentioned that when addressing childhood trauma, they sometimes see better results on the left side. What's your biggest bang for buck approach to address bloating? Thanks, Chelsea. And I also just want to mention, if you have any, we have a bunch of questions that came in advance to go through, and I'm guessing I'm not going to have additional time to go through more questions this morning, but if you do have any, put them in the chat or send them through Instagram or Facebook, or you can send an email to info@boosthealing.org. And if we don't get through it today, we'll definitely do it during the next Tea Time Tuesday, which will be the first Tuesday of November. And if we do have time today, happy to go through it today. So SGB, left versus right side. The most of the data on stellates is on the right side. Most of the data is on men, and most of the data is on vets. And what we've found anecdotally is it seems like the left side tends to work better for women, or I should say, women have a higher percentage of good results on the left side. I don't think it's possible that Stella at this point has more data on this because they have a large group of providers providing stellate ganglion blocks all around the country. So they might have been able to, at this point, look at the data more. In general, the left-sided vagus nerve, so when I do them, I also block the vagus nerve. Depending on how you're doing the stellate, if it's done via fluoroscopy, which is basically an X-ray, you can't get the vagus nerve. You also can't really get in the fascial plane that the stellate ganglion is with great accuracy. So doing it with ultrasound, you can get the vagus nerve and you can also get in that fascial plane. So just saying that in advance, that some of the practitioners are doing it with fluoroscopy, which is not getting the vagus nerve. The vagus nerve on the left side is more for cardiac and gut innervation. The right side is more emotions. And we're doing broad strokes here. So I find, for gut bloating, probably the left side would be better. And they're cumulative. So I always do the one of the sides first and then the other side after. So I pretty much don't let anyone just get one side anymore. And it's because they're so synergistic. So let's say that you have 100 units of stress, and then let's say that we do one side and it drops it down to 50 units of stress, and it drops it 50%. And then let's say we do the other side and that drops it 50% again. So you're at 25 units of stress. It's hard to predict really which side is going to work best for people. I would say approximately a third of people have a really profound experience at the office where, they might be releasing a ton of trauma right there, crying, etc. A third of people don't notice a lot in the moment, but they notice it over time. And a third of people really don't notice it at all themselves, but family members and friends do. So I would never say that it didn't work unless, 6 weeks or something goes by and neither them nor their friends nor their family nor questionnaires show that they have improved. So I think, Chelsea, to answer your question, I would probably do both sides. And if for some reason you had to just do one side, just do the left side, or sorry, just do the left side, because that's more cardiac and GI, which is, it sounds like maybe what that practitioner said. And then the other thing to consider is getting a celiac plexus block as well, which is something else that affects the GI innervation directly. And other things to consider are doing other injections in the neck. Okay, next question is, do stellate ganglion blocks help with swollen joints? And it says, my question is, does stellate ganglion blocks help with swollen joints? I have developed this in my wrist and knuckles since I had COVID, and it's getting worse. Would that help? And this question is coming in from Dolly. So the way I look at these nervous system reboots is, imagine if I had a knob right now, and imagine if wherever you're sitting, if I could turn the knob up, 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 up until you have pain everywhere in your body, or I could turn it down, 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 down until you don't have pain anywhere. The stellate is a way to turn the dial down. Anything that causes inflammation is going to cause aging and all the diseases of aging. Anything that sensitizes our nervous system is going to increase pain. So we know, that if you don't get enough sleep, if you eat a bunch of sugar, if you're under a lot of stress, things like that, your pain is going to go up. So by turning down the dial on our nervous system, pain goes down. Now, the question here is more specifically the swelling. So the swelling oftentimes is related to immune system. And most likely, if this is kind of post-COVID, it's a little bit of an autoimmune response. And autoimmunity, I think of it as kind of like a big, broad category of like your immune system has gone a little bit sideways. It's not doing exactly what it should. So our immune system, when we have an acute infection like COVID, your immune system should like send out all the resources to get the virus taken care of, and then it should go down. And what happens with long haul COVID, with all sorts of long conditions like Lyme, EBV, we talk about chronic fatigue, as the immune system gets ramped up and then it doesn't come back down. The immune system is mostly in the gut, and the nervous system and immune system are really intimately connected. So your nervous system is in your central nervous system is your brain, and then you have your spinal cord coming out of your brain and all of the cranial nerves coming out of your brain. The vagus nerve is the longest nerve in the body. It's a cranial nerve. It comes out of your brain, and that also goes down to your gut. So if that nerve is out of balance for some reason, it's going to send messages to your gut that might cause inflammation in your gut. So leaky brain and leaky gut are really intimately connected. And then most of your immune system's in your gut. So in this case, after an infection like COVID, if the gut is kind of out of balance and the immune system's out of balance, that can cause this swelling. This stellate can kind of help to balance the nervous system, the central nervous system, which can help balance the enteric nervous system, which is the nervous system around the gut, which then can help balance the immune system. So the longer that I do this, the more I think that a lot of it comes down to like getting the immune system and getting the nervous system in balance. And if we do that, everything else kind of falls into place. Not 100% of the time, but it does work a lot of the time. Okay, next question. Past trauma, stuck in sympathetic nervous system when injured, slow healing. The question is nutritional ideas. So the further here, I have a lot of past trauma and my nervous system seems to be stuck in flight or fight. As a consequence, when I get injured, the pain can be sticky. Things that should heal quickly seem to take a very long time. What can I do to nutritionally support myself? I am open to any other suggestions. Thank you, Ashley. Okay, so this actually is like a perfect question to kind of go after that last question. So when things don't heal well, that's the immune system. So basically, Ashley, your immune system probably after all the trauma is not in balance. It's not optimal. And it's probably somewhat because you're getting, like you said, you're getting stuck in sympathetic in your central nervous system, and it's not sending optimal signals down to your gut's nervous system and your gut. So we could talk about like what you could do to nutritionally support yourself. And I would actually take a step back and look at like, hey, like you might be eating perfectly nutritional food, but you're just not absorbing it. So when you have gut permeability, people call it leaky gut, you're not going to absorb nutrients well. So you might be eating the most healthy foods out there, but you're not actually absorbing it. So what I would invite you to do is look at making sure that your gut is in balance, making sure that you're not having gut permeability, making sure that you're absorbing your nutrients well. There's lots of different ways to do that. We usually start with doing a poop test, which is basically a microbiome test to see what's actually happening in your microbiome. And then we can also look at micronutrients and how well you are or are not absorbing them. I think other things to think about in terms of healing is if like, let's say you have genes that make it such that your tendons, for example, are more likely to get tears in them. And genes, just to be clear, genes are kind of like, I think of it a little bit as like the blueprint for how your body works. And genes are not your destiny. So for example, like you could have a gene for alcoholism, but if you don't ever drink alcohol, you're never going to become an alcoholic. So potentially, Ashley, like you might have a gene that makes it more likely for you to have tendon problems, like just since you're talking about injuries and things can be sticky. So let's say like you're running, you kind of injure your Achilles tendon and it's not healing well. That might be an issue of your genes, and potentially supporting with collagen could be super helpful. So that's like one little example, but we practice what's called personalized medicine or precision medicine. So what we want to do is basically make sure that we are looking at exactly what your body needs, which is going to be different from what my body needs or what someone else's body needs. So if we're looking at, like, for me, like what I need to heal well, like if my genes don't work well with collagen, if I need to have collagen supplementation, great, I would do that. But maybe for you, that's not what you need. Maybe you need methylation support. So it's a little bit complex, but I think like big picture, getting some of these treatments that can balance your nervous system and balance your gut are most likely going to help all these other questions in terms of like healing well, making sure that you're getting enough amino acids in. We also look at, like, with respect to genomics, we look at like, what is your optimal percentage of macros? And by macros, I mean like what percentage of your diet should be from protein, what percentage should be from carbohydrates, and what percentage should be from fats. And what I've found is almost across the board, most female athletes are not getting in enough carbs. So we've had this real move towards like paleo and keto diets, which are not bad, but a lot of times women end up not getting enough carb calories. There's a woman, Stacy Sims, she wrote a book called Roar, and she's done a lot of research on this. Unfortunately for women, and really for anyone other than white men, most of the research that we have on a lot of these things is on white men, which is amazing if you're a white man. But if you're a woman and you're like, hey, how can I not get injured? How can I optimize my performance? If you apply what they say for men, it's not going to work well for you. And we see this with a lot of athletes. Like I ran track and cross country in college, and like looking back, if I had like exercised way less, I probably would have done way better because I would get injured all the time. And this is pretty common. So for you, that might be something as well, that like you need to actually increase your carb intake. So how you can look at that is there's various apps where you can track your macros, and then we could look at your genes to see like what's optimal for you. And what Stacy Sims has found is that for most women, when they exercise less, like, and these are like high performing competitive women, when they exercise less and eat more carbs, they actually perform better. So something to consider. But I would want to look into like specifically for you what your body needs. When we extrapolate and say like, hey, this is what everyone needs, it works for about 60% of the people on average with most things, and it doesn't work for the other 40%. And that includes pharmaceuticals as well. We get pharmaceuticals approved, things like statins or SSRIs, and they work really well for some people. And they work really not well and cause harm for other people. So it's really helpful to look at pharmacogenomics to see like what works for people, or just, genomics in general to see what works for people. Okay, awesome. Thanks for that question. Next question. Sudden excruciating needle sensation in the back of my knee and calf and stiff hip. Joint is better with exercise. Worried about a blood clot. Do what? A little more information here. Sometimes I suddenly feel excruciating needles in my calf at the right side of the back of my knee. So painful that I scream out, but then it stops as suddenly as it started, but I can go months without it. I also sometimes feel a kind of stiff pain in my hip joint. I read somewhere it could be arthritis. My grandma had arthritis. With exercise, hip feels better though, but I'm worried it is a blood clot in my vein, but the doctor said it was nothing. She couldn't find anything just by feeling the spot because it didn't hurt then. That was last year, but now the needles have returned. Do you have any idea what it could be? Thank you, Noemi. Okay, awesome question here, Noemi. So this is like actually a great opportunity to talk about nerves. So first of all, super easy to look to see if you have a blood clot. That's just an ultrasound evaluation. Like if you lived close by, you could just come into the office and I could check you with an ultrasound, which isn't 100% perfect, but it's pretty good. And then we could do a blood test to make it, nothing's 100% except that we're all going to die at some point, but pretty close to 100%. Most likely from what you're describing, you're having some nerve entrapment somewhere. So let me see if I can grab one of these. So imagine, you can see this cord here if you're on, if you can look at the video. So imagine that this is a nerve. Like, let's just say, for the way the pain goes down, just because everyone's heard of the sciatic nerve, likely what you're saying kind of with the hip, and going behind your knee, it's probably not your sciatic nerve, but it could be. It does kind of go in that direction. So your sciatic nerve starts kind of up in your spine, really, and then comes out and then goes down behind the back of your butt and then down your leg. So the nerve hangs out in fascial plane. So if you can see this cord here, if this is a nerve and the nerve is in the fascia here, and my hands are the fascia, the nerve should flow easily in the fascial plane. And then what happens sometimes is it gets grabbed. So that can be from injury, from infection, from inflammation, sometimes just from anatomy. And if it gets grabbed, then it pulls. And then the pulling can cause pain going down your leg. And the other thing that can cause is things like numbness, needles, et cetera, et cetera. So what we can do is we can inject in the fascial plane, release the nerve, release that entrapment, and the pain goes away. So one thing that I have really learned kind of switching into the type of medicine that I do now is the vast majority of painful situations, it's nerves. It's not the actual soft tissue. And we kind of know that. Like if someone gets a spinal cord injury, you can get some phantom pain, but you're not generally going to have a ton of pain downstream. It's if our nerves aren't working, it's not sending signals to the brain saying, ow, ow, ow. So in this case with you, from what you're saying that you get this stiff pain in your hip, et cetera, it could be that one of the nerves up higher, like your sciatic nerve, is grabbing intermittently. And it actually does go down the back of your leg, kind of behind your knee, and it splits there, but it's basically a branch of the sciatic nerve. If that's grabbing, it can certainly cause a ton of pain. Imagine if you took your finger and you put a rubber band around it so that you couldn't feel your finger, like it's just totally numb. And then imagine if like you release it a little bit and the blood supply starts going back, that's going to be super painful. Or if your hands got really cold out in the snow or something and they get numb and then they wake up. So it could be actually that your knee or this nerve, excuse me, that this nerve is actually blocked. Like it's kind of like it has a rubber band around it. So you're not actually feeling much. And then sometimes you feel more and that causes the pins and needles, or it could be the opposite, that normally it's working well. Like again, back to the finger, my finger feels fine now. If I put a rubber band on it, after a while, it's going to start to get pins and needles. It's going to start to get really painful. And then I'm not going to feel anything. So that happens with nerves as well. The other thing to think, like, let's say you do have some arthritis in your knee and your hip. If those nerves that are going to the knee and the hip, they're sending messages back to your brain, potentially saying like, ow, 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 those nerves are going to get bigger and bigger. And as they get bigger and bigger, then they're more likely to get entrapped. So the part of the nerve that sends like the long, painful signals they're called the C fibers, as opposed to the myelinated part of the nerve. So like if I touch a hot fire right now, I'm not going to think about it. Like my nervous system is going to make me pull back really quickly so I don't burn my hand. That's a fast moving nerve. And that's kind of like to protect us to survive. And then we have all the slow nerves that are the C fibers, that when those get activated and when those turn into kind of 5-lane highways instead of little paths in the woods, is how I describe it, then what can happen is the pain happens all the time. So let's say you injure your knee and those nerves get irritated, the C fiber nerves, and then the injury heals, but those nerves are still big, you're still going to have that pain. Or say like your knee heals 80%, but not 100%. If we release the nerve in your knee, going to your knee. That's going to not only help with the pain, but it's going to also help the signals go from your brain, from your nervous system down to your knee to help your immune system to heal that area. So whenever the nerves aren't working well, things don't heal well. We've noticed that with things like arthritis, if the nerves are treated around, let's say, knees, since we're talking about knees, even without injecting into the knee, a lot of times the symptoms improve and the cartilage will start to regrow. So we need to have the operating system, which is the nervous system, working optimally. So a lot of the treatments that we do, whether it's these central nervous system reboots, enteric or gut nervous system reboots, or the hydrodissections, it's all about getting the nervous system working better. And I really believe, the longer that I do this, that if our nervous systems are working well and our immune systems as well, that like the vast majority of symptoms go away, which is pretty amazing. And on that note, conventionally, what we do a lot, and I worked in conventional medicine for many, many years in the ER, is when the immune system's out of balance, we give steroids. And the steroids actually block the immune system, which actually is kind of preventing us from healing ourselves. Or we get infections and we take antibiotics, which then messes up our microbiome, which messes up our immune system. So a lot of the conventional treatments, they work really well acutely, most of them. And some of them are necessary. Like sometimes if you're having, a really big inflammatory response and your lungs are filling up with fluid with an immune response, like, yeah, we need to give you steroids so that you don't drown in your lungs. And for most of the time when we give steroids for like chronic knee pain, for example, that's impacting your immune system and it's long-term impacting your ability to heal itself. And then it's also impacting your immune system's ability to identify damaged cells and get rid of them before they cause things like cancer. So by addressing the underlying stuff, it really helps everything else to heal. Okay. Okay, moving on here. Bioidenticals for men. Thanks for doing this talk. We enjoy listening to them. My question would be, can you share your perspective on bioidentical hormone treatment for men? I've been taking my testosterone levels for the past 1.5 years, and I'm routinely around 330. I'm in my early 40s and have done extensive gut work, meditation, breath work, good sleep hygiene, structured supplements, and strength training, but can't seem to boost it. My functional practitioner is recommending bioidentical treatments to help with some current health concerns, lower libido and energy, but mainly due to long-term health risks from these low levels. Can you share what you typically recommend in this space? Speaking with other doctors, there's a lot of conflicting information in this space, and it seems once I go this path, it'll be a lifelong commitment to continue treatments. Thanks, Joe. So this is a great question. Let me just be clear what bioidentical hormones are in case people don't know. So bioidentical means that it's the same structure as we have in our body. So testosterone, progesterone, estrogen, just talking about hormones in general, thyroid hormone, et cetera. If it's the exact same structure that we have in our body, it's bioidentical. If not, it's synthetic. And something to note is pharmaceutical companies cannot trademark and therefore make money off of a hormone, for example, or any drug if it's bioidentical. So they can't take like testosterone in our body in the exact same form that it is in our body and then trademark it and market it and sell it. So example around this is like Synthroid, which for a while was, I think, the most prescribed drug or one of the most prescribed drugs. It's still, I'm sure, quite up there. And it is synthetic T4, so thyroid hormone. And basically, it's just like a little change of a bond or two that then makes them allowed to trademark it versus bioidentical thyroid. And ideally, I think it makes sense. I think everyone could agree that it would make sense for us to give our body what our bodies are used to rather than something synthetic. So just something to be aware of around that. Hormone replacement therapy. There's so much confusion around this. So in my training conventionally, I kind of got the downloads of like hormone replacement therapy is dangerous. It can cause cancer. It can cause blood clots. I thought I would never touch hormone replacement therapy with a 10-foot pole. I was in the ER. There would be no reason that I would. And as I started moving into this arena and spending more time looking into it, I realized like, absolutely, we need to have optimal hormones to heal well and feel well. I think in the future, we'll probably have better ways of doing it than we do right now, maybe using precursors like peptides to help boost our own production of hormones and regenerative products. But for right now, I think the best we have in general is bioidentical hormones, and then all the things that you're doing to help boost your hormones. And it sounds like you're doing a good job with all that. So high fives on that. A couple things to be aware of with this. You want to make sure that you're safely metabolizing the hormone. So if you're taking testosterone treatment, your body, depending on how inflamed you are, depending on how your metabolism works, you are going to convert maybe a lot of the testosterone to estradiol, which is the most active form of estrogen, or maybe just some of it. And then depending on how your body works, you might get rid of the estradiol in a super safe way, which is not going to cause any harm to you. Or you could get rid of it in a dangerous way that could potentially make you susceptible to developing cancer. So we need to look at the whole picture here. Like, so short answer is like 100%, like if your levels are low, we should support it. That's going to help you heal better, feel better. And, if you're 40, as we get older, for men and women, our hormone levels are just going to naturally drop. We're at this time right now where we have like so many amazing treatments, and people are doing a lot of research on this in terms of reversing aging and preventing aging. And I think like in the near future, we're going to see some really wild things, like, women having babies in their 70s, things like that. Like that's probably coming really soon, and people living to ages that we never would have expected before. Inflammation, I think I said this already today, and anything that causes inflammation is going to cause aging and all of the diseases of aging. So anything you can do to cut down inflammation is going to slow down that process. And the reality is, like, if you're in your early 40s, you have lived 40 years on this planet being exposed to all these things like the lights that I'm under right now, and probably not living, exactly like your ancestors did. So, if you look at the length that humans have been around as the length of a football field, what our time right now with like living inside, having blue lights, exposed to all these pesticides and hormone disruptors, et cetera, is only like the final meter of the football field. And we just have not had enough time to evolve. And so what that means is our bodies, like we're under too much stress, like to deal with what's happening. And so we actually need help. Like a lot of times people will say like, hey, like, why not just move off the grid and like drink spring water and eat natural foods? And you don't need any of these, crazy anti-aging supplements and treatments. And I totally agree. Like if I could live off the grid and like live like my ancestors did, amazing. But like what percentage of people can really do that? Like very few people. So if you can, awesome. And for most of us that can't, we need to do things that are going to mitigate the impact of the environment that we live in. And so many hormone disruptors out there. And so by supporting, we want to address always the underlying things. So like other things that could cause your testosterone to be low, nervous system, right? So we've talked about the stellate ganglion block a little bit. Like if your nervous system is out of balance, even if you're doing all these things, if your sympathetic nervous system is upregulated, you're not going to produce hormones as optimally as you could. So by addressing all that as well, that's helpful. And then again, like you're in your 40s, so you have lived on this planet for 40 years under the environments that you've lived under. And so probably supporting is going to be helpful. And I would want to see like, how are you metabolizing? So doing a urine and saliva test in addition to a blood test, and then following up on that. I think where we run into problems with hormone replacement is when people just get a blood test, like particularly with testosterone. Like if you just get a blood test and then someone starts shooting you up with testosterone every couple of weeks without looking how you're metabolizing it. And if you metabolize to estradiol and then out pathways that aren't really safe, that could make you susceptible to things like cancer. Important to note, though, that low levels of testosterone make you susceptible to cancers like prostate cancer. So optimal hormones, super, super important. With women, I know we're talking about men right now, but with women, estradiol starts to tank, usually like late 30s, early 40s, long before we stop cycling for most people. And with that, our immune function drops and our cognition. And so since I started studying all this, Sarah Gottfried is a doctor who's an MD who is trained in OB-GYN, who also does a ton of functional medicine. She's written a bunch of books on hormones, and she has been one of my instructors in some of the courses that I've taken. And she really advocates that we should be intervening early. So if you imagine like your estradiol levels are here when you're like 20 and they're here postmenopausal, you don't want to wait until you stop cycling to intervene, because that also is where your immune and cognition is. So ideally you start intervening early so you don't get that fall off with the immune system and cognition. And most people are still not starting, a lot of times not starting the estradiol until later. And still, like, later is better than never. And starting earlier, I think, is better. So for your question, Joe, I think probably based on your age, I would start the bioidenticals, and then, lifelong treatment. I don't know. We're in this real time right now that it's really quite astounding how things have changed in medicine in the past 10 or 15 years. Like, we can inject things into spinal cord injuries now and get function coming back, like things that I never would have thought were possible. So I don't know. I mean, it's certainly possible with like all the innovation that's happening right now, on all sorts of levels, on the, physical, mental, emotional, and spiritual levels in the world right now, that maybe it's not a lifelong thing. Maybe a couple of years from now, we figure out how to get you to naturally produce testosterone the rest of your life. So I think there's so much innovation happening that I would be hesitant to say that, but like based on information now and like our current systems and our current information, that's probably accurate. Okay, next question. Got to drink my tea and tea time Tuesday. Getting pregnant with premature ovarian insufficiency. What's your approach to getting pregnant naturally for a 39-year-old woman who has gone into premature menopause due to premature ovarian insufficiency, already living a healthy lifestyle, taking targeted supplements, mind, body, spirit work, etc., taking bioidentical estrogen and progesterone to have a period? Thank you, Meredith. Okay, awesome question. I think maybe I'm like simple-minded when I look at everything. So conventional medicine loves to put things into categories, right? So like if you're having trouble getting pregnant, you go to a fertility doctor. If you're having diarrhea, you go to a GI doctor. If you are having like eye pain, you go to an ophthalmologist. And I like, the more I do this, the more I think like, of course, and this is not rocket science, like, of course our body is all connected. And of course, like what's happening, if you have eye pain, that's not just your eye, most likely, pardon me, unless you like had some sort of trauma. And so we need to look at like what's happening in the whole system. And Chinese medicine, Ayurvedic medicine, both of which have been around for thousands of years, look at everything, whole systems, systemically. Naturopathic medicine, chiropractic medicine. It's really it's been very recent that we've had this sort of reductionist model of kind of like modern medicine, where we divide things into these different areas and don't really look at everything together. And I think there's also a lot of like, unfortunately, there's a lot of like capitalism that's playing into this, like what makes money. So, drugs make money, procedures like surgeries make money. And so there's not a whole lot of motivation to get people well. And I don't think this is nefarious. I don't think there's anyone that's sitting there saying like, let's keep people sick so that we can make money. I think it's like, they're like, oh, this drug works really well. They tell the doctors this drug works really well for rheumatoid arthritis or whatever. Doctors prescribe it. Patients are doing better. Everyone's happy, but we're not addressing the root cause. So in your case, I would want to know, like, it's awesome that you're living a healthy lifestyle, you're taking supplements, etc. And I would want to know, like, has anyone done a deep dive to really look at what else is happening here? So specifically when we talk about like function of ovaries, like, so that's what we're talking about here, or uterus, like female sexual organs, I would argue that like every single human alive right now has rape in their nervous system, right? Whether it's in this lifetime or not, we know from research that that our nervous systems hold trauma for up to 12 generations and probably longer. And that's not even talking about, like, if you want to talk about past lifetimes and things like that. So I would wonder, like, what's happening with your energy flow around your ovaries. And I would look at that. I would look at that from lots of different angles. So, like, do you have trauma stuck in your body from this lifetime or another lifetime, or generational, that we could help release? Do you have something happening with toxins, right? So were you exposed to some sort of toxin, mold, infection, et cetera, in your life that potentially is impacting this? What does your microbiome look like, and the nervous system? So again, like, I kind of go back to, like, foundational things, like, is your nervous system working optimally? Is your gut nervous system working optimally? Is your immune system working optimally? And then specifically with ovaries, like, what sort of trauma might you be holding in there that on some level your body is like, it is not safe. Like, this is not safe. It's not safe to have sex. It's not safe to have intimacy. And then it kind of decreases the energy flow there. I think I would argue that, like, most women are pretty disconnected from that source of energy. We're told from the time that we're quite young, like, that if we're running our sexual energy, we're sluts. If we kind of step into our power, then we're, like, bossy. If we advocate for ourselves, we're bossy. It's like a red flag for women. And men, it's the opposite. The clitoris has 10,000 nerve endings, and the only purpose that science has found as of now, as of October 3rd, 2023, is pleasure. And so, like, women should be using pleasure as their compass. And most women are not. Most women are so disconnected from that and shamed about that, right? Like women are taught to, like, sort of be in service to everyone around them and not look at, like, what is helping them. And so there are pleasure coaches out there that I think could be super helpful. I would wonder if you start spreading that energy and getting that energy running, if that alone would fix the problem. It's pretty astounding how just running that energy can heal a lot of things. And when we talk about sexual energy, there's, like, the energy flowing, and then there's also the neurotransmitters that get released. So things like dopamine, oxytocin, serotonin all get released with orgasm. So if you're not having orgasms enough or a lot, and you're not spreading that energy, you're not getting those neurotransmitters. And then the other thing that can happen sometimes is your body, the neurotransmitters are actually produced in large part in your gut. So if your gut's not in balance, you're not going to produce those as well. So I think, like, just with this, like, small, I don't have a ton of information on you, but that would be my first question, is, like, are you blocked energetically there? And then there's things that we can do energetically, like grounding cords. Like, imagine putting a grounding cord, connecting it to your second chakra, putting cords that go to your ovaries, that go to your sciatic nerve, that go to your, like, kind of primary energetic center, which is basically your second chakra in front of your uterus. And imagine grounding out all that sticky energy. So women get men grounding through them all the time. Like, women are allowed in our society to feel emotions more, and men are not. And so men are always throwing their energy at women, and it's getting stuck in women. So that's how I would approach it. I would approach it from all ends. Of course, like, looking at your hormones and hormone levels and all that, and the area that chances are maybe you haven't explored as much as, like, the pleasure, the energy flow, and potentially the nervous system. Great question. Okay. The next question, need hysterectomy for fibroids. So I have been to 2 gyne physicians and found proof of some 1-inch fibroids covering my uterus. I have had 10 years of extremely heavy periods, but never went for a checkup because the last gyne told me to take ibuprofen for a couple days before my periods to reduce the clotting and pain. The pain is piercing during periods now, and a low chronic pain between my periods. I'd like the pain to go away, but do I have to have a hysterectomy? I'm 47. My periods are still monthly, but getting shorter between. I have Hashimoto's thyroiditis, osteoarthritis, chronic body pain for 20 years, which is worsening. It's a lot. But taking out organs, thank you in advance for any answers. My best, Tanya. Okay. this is great. Like, I honestly didn't read these questions before, and it's like amazing. The universe like sets them up perfectly. So your question kind of like is a perfect like follow-up to the last one. So fibroids. Fibroids are, on the uterus, growths. I think like our conventional medicine approach is like, okay, you've got a growth, let's cut it out. But why did you get the growth in the first place? And I think that's kind of what you're getting at here. And everything that we've talked about now up to this point today supports the answer around this. So I would look at like, do you have stuck energy flows down there? Because if you have any stuck energy, that is going to impact your uterus's ability to be optimal. So that's like kind of first and super easy, not necessarily easy, but something to look at. Pleasure coaches, like doing practices that help spread that energy, I think would be super helpful. I'm going to back up and say that in general, I would avoid pulling out organs or like cutting nerves as much as possible. Like I am with you. Like, I think in general, that's not a good idea. Sometimes it's far enough along that you have to. Ibuprofen, let's talk about that for a minute. So ibuprofen, amazing. Anti-inflammatories, amazing that they can block certain pathways so that we don't feel as much pain. Unfortunately, ibuprofen will mess up your gut most of the time. So when your gut gets messed up and you're not digesting food well, what ends up happening is you get gut permeability, inflammation in your gut. The inflammation in your gut, I think of it like a fire, and then that fire in your gut sends a message up via the vagus nerve to your central nervous system, and it's going to like turn that dial up, right? So then you get pain all over the place, just like you were saying, chronic pain. So if you wanted to like have a lot of pain, do everything you can to that's inflammatory. If you want to decrease pain, decrease inflammation. So ibuprofen, much like steroids, amazing medicines for like short-term relief of inflammation, but it actually causes like long-term increased inflammation in most cases because it disrupts the immune system, which is in the gut. So generally speaking, like I think almost no one should be on any sort of NSAIDs, long-term non-steroidal anti-inflammatory drugs like ibuprofen, and almost no one should be on PPIs, which is acid-reducing stomach medicines long-term. I'm sure there's exceptions for anything and everything in life, but really almost no one should be on that. Now, in terms of like reducing clotting, so like what is causing you to clot? So clotting from a Chinese medicine perspective, like when you have a ramped up nervous system, you're going to clot more. So after COVID, lots of people were getting lots of clots, lots of reasons for this. Like we can look at this from like the really nerdy, what's happening on a cellular level. We can look at it energetic from a Chinese medicine standpoint. When your I think it's called the triple warmer is activated, like your nervous system is really ramped up, that can cause you to clot. If you are inflamed, that can cause you to clot. When your immune system is out of balance and you're inflamed, that can cause you to clot. So instead of taking something that is going to like treat the symptom, I would like to go back to like, why are you clotting, and look into that some more. And then depending on why you're clotting, then we can sort of address that. The next thing to look at is the Hashimoto. So what a lot of people don't realize is the connection between the thyroid and then other proteins. So if you look at thyroid protein under the microscope, and then you look at gluten, for example, and casein, which is the primary protein in milk, they almost look identical. So if your body is attacking your thyroid, you're almost certainly also reacting and attacking some of these other proteins. And so I would say, like, if you haven't cut some of these things out and checked into it, definitely check into it. Autoimmunity. We have all these names for autoimmunity, like in your case, Hashimoto's, osteoarthritis. You probably, if I went through everything in your body with a fine-tooth comb, I could find other autoimmunities. I really don't care that much about what the diagnosis is. What I care about is that your immune system is out of balance. And so your immune system is attacking yourself instead of like attacking infections that are coming in and getting rid of damaged cells before they cause things like cancer. And so what I would want to do with you is look at like what things are causing your immune system to be out of balance. And like easy, like kind of low hanging fruit is get your nervous system in balance and get your gut in balance. So nervous system injections like the stellate ganglion block. We also do hydrodissections of the cranial nerves. So 12 cranial nerves come out of your brain in addition to the spinal cord. If those cranial nerves get stuck, like let's say they get grabbed along your C1 vertebral process or down by your sternocleidomastoid muscle in an area called the ansa cervicalis, if those are grabbed, they're not going to send optimal signals. And if the signals aren't being sent properly, it's like if you're sending a message via email, via walkie-talkie, old school, and you write a message. I send an email to you and I say, hey, like, can you make sure you start this webinar at 9 a.m.? And the message comes through at start the webinar at 12 p.m. Like there's a scramble in it, then it's not going to work right. So that can happen with our nervous system. If the nerves aren't working right, the signal gets scrambled and then things don't work right. So I would definitely look at that. And then also just the turning down the dial. And then just the energetic component. So I feel like we know that there are lots of examples of people having these like really inexplicable spontaneous healings, right? So someone that has like stage 4 metastatic cancer has a spontaneous, they're told, they have a month to live and then it disappears. And from an MD, like my training, it's like, what is happening there? How can we explain that? None of the treatments that I'm talking about with, balancing the nervous system, like that alone is definitely not going to reverse things like that. So I think there's a real energetic component that we're really missing, that I think some of these older types of systems-based medicines like Ayurvedic medicine and Chinese medicine do a better job of. And I think we're at this point right now where we can do an even better job at looking like, for the first time really in history, we have the bandwidth. Like we're not worrying, most of us, plenty of people in the world are, but I'm sure everyone listening to this, probably most of you are not worried about where you're going to sleep tonight or how you're going to get food today. And for the history of humanity, most people, most of the time, were just worried about like the basic survival things. And so they didn't have the bandwidth to look at like, hey, like, how is trauma impacting me? How are my beliefs from like what my parents told me affecting me? Like that was nothing that anyone talked about until quite recently. We're having this real shift in consciousness. And I think as this happens, like in your case with the Hashimoto's and the fibroids, like the question is like, what is the block here? So there's a book that I refer almost all my patients to, and it's by Lise Bourbeau, and it's called Your Body Loves You. And it's basically a little encyclopedia of what the spiritual, emotional, mental, and physical blocks are around various different illnesses and conditions. And so the question, and I don't know offhand what the block is for fibroids, but the question for you would be like, okay, what's the block? Like what belief system, like how is this helping you? Which sounds wild, right? To think about like, how is an illness helping you? But if like we get into these systems where like, if I have, like let's say, for example, this is a common one, like asthma for kids. A lot of kids that have asthma, it's a way, and they're not doing this consciously, but it's a way to get attention. And it's not conscious at all, but their bodies are kind of like helping them to get the care that they need, or maybe helping them to get out of an unsafe situation. Our bodies are so smart. Like your body wants to be in balance. Your body wants to heal. So the question is like, if you're having fibroids, like what is that message? And so you can look at one of these books of what the metaphysical cause of your illness is. You can also talk to yourself. You can talk to your body. You can ask your uterus like what it needs. And probably you've never talked to your uterus before. So it's going to might take 20 times of like after meditation saying like, okay, uterus, like I'm here to listen to you. And it's kind of like if you've been if you had a relationship with someone, but you didn't nurture the relationship, you didn't talk to them, they might think like, okay, you're never going to talk to me. And then if you start talking to them, they might not trust you for a long time. So you need to like build this rapport. So I tell people like, start talking to your body, see what your body has to say, and don't expect anything for probably 20 times. And I think a lot of people do it a few times, and they're like, I didn't hear anything, and they stop. So that would be encouragement as well. And in terms of the pain that you're having, like, pain is our body trying to speak to us. So again, like we talked about all these different ways to reduce pain, but like, what is the message? Like, what is your body trying to tell you there? And I think the more that you can like listen to your body and get that message and shift things, things can get better. And another thing is like living, that's come up a lot recently, is like living in integrity and living your truth. So, for example, if like a lot of us spend a lot of time not living in integrity and our truth, and we maybe don't even know it because society tells us we're supposed to live a certain way. So if you're living a certain way, but that's not your truth, and you're kind of effectively like lying to yourself and gaslighting yourself every day, that's going to show up as physical illness. And there's a book called The Way of Integrity by Martha Beck that you could look at and see if that resonates. So we just talked about a lot of different approaches. And like, if you came in and talked to us, we would just kind of go through all these things and see like, what's the portal for you to get things in balance. And it's different for everyone. All right. Go-to treatments. What are your go-to treatments for heavy metal poisoning, Lyme, and mold issues? And this question is from Liz. So I think like big picture, with these, great question, like this question comes up a lot. Probably at this point in this talk, you can probably gather I'm going to say that we're going to go to foundational stuff first, right? So if your body is really good at detoxing and your immune system is good, you can be exposed to mold and you're not going to have any chronic issue. I use like a bathtub model of thinking about it. So if you think of like your body, your biologic systems as a bathtub, and then all of the water coming in, or all the internal and external stressors coming in, the drain is your body's ability to detox. And then if your bathtub overflows, you get symptoms. And then what happens is like, you might have, like in this case, maybe your bathtub is a quarter full from chronic heavy metal poisoning. It's a quarter full from Lyme. It's a quarter full from mold. And then maybe you get COVID and it overflows and you have a ton of symptoms. So I look at like, what's the easiest way to approach this? Like to basically get your bathtub not overflowing. So things like the Stellate Ganglion Block, things like Wim Hof breathing, breath work, cold exposure, fasting, that can effectively like increase your bandwidth, increase the size of your bathtub to turn down the drain. Like let's say with heavy metal poisoning, to turn down the flow. If you have mercury fillings, for example, get them out. So that's going to turn down the flow of stuff coming in. If you live in a moldy house, get out of the moldy house. There's not really a way to do that with Lyme. And then how do we get the drain to open? So things like methylation support, things like sauna. We do lots of treatments, various different ways to detox, including like protocols that increase your body's ability to kind of kick the poisons out of your soft tissues and get them out of your body. And then treat things like ozone, which also helps helps with your body's immune system regulation and detoxing. The nervous system treatments that I've talked about a bunch, by getting your nervous system in balance, that helps to get your gut in balance and your immune system in balance. So again, nervous system, immune system, nervous system, immune system. Like, I think that's so foundational for everything. Lyme, let's talk about Lyme for a second. My approach right now, Lyme is a pain to treat. It's hard to treat, as anyone who has Lyme knows. And so, and if we just like get rid of the Lyme, but we don't address like the underlying cause of like, why was that illness allowed to like kind of stay in your body? There's going to be something else. It's sort of like if you treat the cancer, but you don't treat the underlying issue that allowed the cancer to happen, you're going to get something else that pops up. So my approach with Lyme actually is more like getting the immune system in balance, getting the gut in balance, getting rid of like the easy things. So it's easier to treat heavy metal and mold. And then when the body is in balance, when the immune system is in balance, the immune system can clear Lyme. So if you get a bunch of people that all get bitten by ticks, not everyone is going to get chronic Lyme. Same thing, like if you have a bunch of people that all go in a moldy house, not everyone is going to have chronic mold stuff. So I look at like what's the easiest to treat, and then get kind of, that's like if we get rid of the mold issue, it's like taking a 5-gallon bucket and getting a bunch of water out of your tub so it's not overflowing. And then when you have the bandwidth, your body knows how to heal itself. If you cut yourself, you don't do anything else, your body's going to heal. So I'm just like, my approach is like pretty simple. It's like, what can we give your body? What can we take away from your body so that your body can heal itself? And that is always what's happening. Just to like mention that no practitioner is ever healing anyone. It's the person is always healing themselves. And depending on the type of practitioner, there's different approaches to help. But like even getting surgery, you could take out an organ or you could line up a bone, but your body is actually doing the healing. So all we're doing is helping your body on that. Okay, final question for today. London referral for ultrasound guided SGB. I am in London in the UK. Is there anyone you could recommend who works in a similar way to you and does ultrasound guided stellate ganglion block? Thanks in advance, Sheba. So I don't know of anyone in London. And I'm sure, I bet that they're like, if you could probably Google and see if anyone's doing it. The other thing is anesthesiologists in general would be able to do that procedure for you. Physical medicine, rehab doctors, most of the time are trained in it if they're more recent grads. Our bigger aspirational goal is democratized integrative wellness centers around the world. So democratized meaning accessible to everyone. So right now, our approach is mostly not covered by insurance and only accessible to like a small percentage of people. And we believe that this approach of like getting people better and helping the body to heal itself is way better than treating symptoms. And so instead of trying to get all of this covered by insurance, our goal is to kind of develop a new system. And with that, have training to train doctors to treat patients in this way, and also to collect research, to collect data so we can show that like, hey, these things actually work. And so this is kind of like the next step of what we want to do with all this. And hopefully at some point in the not too distant future, Sheba, hopefully we have like one of these amazing wellness centers near you. And the idea is like, everyone has access to it, and people who can pay are effectively subsidizing people who can't pay. So on that note, if you hear that and you're like, whoa, I want to, like, I have some gift that I can contribute to make that happen, please reach out. So we have had amazing people reach out that have skills on the business side, fundraising side, building side, etc. So please reach out if this is something that sounds like you would be able to help with the project. Because ideally, I think like we are at this real pinch point with humanity, and if we don't shift the vibration and expand the vibration of humanity soon, we might destroy ourselves, and that would be a real shame. Like the Earth is this really amazing place. And the privilege to live in our bodies and experience all the joy and all the range of emotions that we experience is so amazing. And a lot of people are really hurting right now. And these treatments can kind of move the lever and get people into a way better place really fast. So, people could go away and meditate for 10,000 hours, or they could get a stellate ganglion block, and it has a similar impact on the nervous system. So I think like getting this approach out to as many people as possible, as fast as possible, I think can really move the needle quickly to help save the planet. Or help save humanity. The planet's going to be just fine. All right, that is the end of our time together. Thanks so much for joining. If you have any questions, just send them into the email info@boosthealing.org. Or you can send them via Instagram or Facebook, DMing them, and we'll have another list of questions for next month. And such a pleasure spending time with all of y'all. Take care.